Hello, my name is Catherine Golenko, and I'm an HAI epidemiologist with the Arizona Department of Health Services. Welcome to this webinar presentation titled A Brief Introduction to the ADHS TAPS Report. Recently, CDC has been focusing on preventing the threat of healthcare-acquired infections such as MRSA, C. diff, CLABSI, and CADI. To perform surveillance on these HAIs and use data for action, hospitals have been reporting to CDC's National Healthcare Safety Network, or NIST, which is the nation's most widely used HAI tracking system. State health departments have been receiving more support to reduce and eliminate these infections using the CDC framework called TAPS, or the Targeted Assessment for Prevention Strategy. The TAPS strategy aims to answer questions such as, how's your facility doing at preventing HAIs? How many infections of MRSA and C. diff has your facility seen in the past quarter? How many infections does your facility need to prevent to reach national target goals to reduce and eliminate HAIs? How's your facility doing in comparison to other facilities? What resources and tools are out there to help with preventing HAIs? The Targeted Assessment for Prevention TAPS strategy is a framework for quality improvement that offers a focused approach to infection prevention for healthcare facilities. The quarterly TAPS reports created at ADHS will focus on 4 HAIs: Clostridium difficile infections, or CDI, or C. diff, methicillin-resistant Staphylococcus aureus, MRSA, central line-associated bloodstream infections, CLABSI, and catheter-associated urinary tract infections, or CADI. The TAPS strategy can be used to identify facilities with a high burden of these HAIs so that specific gaps in infection prevention can be identified and addressed. The ADHS TAPS report consists of 5 pages: an introductory letter to the facility, statistics at a glance, a tools and resources page, an appendix page, and a frequently asked questions page. This webinar will review all of these pages along with any terms or abbreviations that need to be defined to better understand the metrics used in this report. In the introductory letter, we go more into depth about a couple of things. First, we describe in a little more detail the TAPS strategy and its 3 main components. First one being running TAPS reports using NIST Data to target healthcare facilities and specific units with an excess burden of HAIs. Administering TAP facility assessment tools to identify gaps in infection prevention in the targeted locations. We'll go into more depth about this facility assessment tool shortly. And the last component is accessing infection prevention resources to address any infection prevention gaps. We also review the 4 HAIs that this TAPS report focuses on: CDI, MRSA, CLABSI, and CADI. Throughout this presentation, CDI will be interchanged with C. diff as well. At the end of the letter, we let facilities know that if we're seeing that their facility has reported a high number of infections in the past quarter, we'd like them to complete a CDC facility assessment tool, or the TAP assessment tool. This should be administered to a variety of staff and healthcare personnel at different levels of the organization, not only infection preventionists, but also healthcare workers such as frontline providers, mid-level staff, and senior leadership. This tool also should be administered to environmental services personnel, as they too play a critical role in HAI prevention. This assessment captures healthcare personnel's knowledge, attitudes, and perceptions of infection prevention practices. The greater number of assessments collected, the greater the ability to identify gaps and target prevention. So at this point, you might be asking yourself, but wait, how do I know if my facility is doing a good job at preventing HAIs? Is my facility reaching the 2020 HHS goals? And what are the 2020 HHS goals? This brings us to the second page, where we have the NIST data presented in a quick, easy-to-process format. In order to understand these statistics and the 2020 HHS goals, there are 4 metrics that you'll need to know about: the total count of HAIs, the number of predicted infections, the CAD, or the cumulative attributable difference, and the SIR, or the standardized infection ratio. The total count of HAIs is presented in the time frames designated by NIST's quarters, basically in 3-month time frames. In the example below, we're seeing that Hospital X reported 19 infections of CDI in the first quarter of 2017, between January 1st and March 31st of 2017. So now we know this facility had 19 CDI infections in the past quarter, but how does that compare with previous data? Well, NIST computes a metric called the number of predicted infections. This is a statistically predicted number of HAIs for a specified time period. The predicted number is derived from NIST baseline data, adjusting for several factors that may impact the risk of acquiring an HAI. These metrics and derivations vary for different HAIs. In the ADHS report, the number of predicted infections for each HAI at your facility will be found in the appendix. Since this number will be used to calculate the other two metrics in the statistics at a glance page, we'll show it now as well. We see that for this hospital, the number of predicted infections is 21.7. And remember, the facility reported 19 infections for that quarter. So far so good then, right? Now we'll get into our first NIST specific metric, the SIR, or the standardized infection ratio. The SIR is the number of observed infections divided by the number of predicted infections. Basically, the SIR compares the number of reported HAIs to the number of predicted HAIs. A SIR greater than 1.0 indicates that more HAIs were observed than predicted, adjusting for known risk factors and differences in the types of patients followed. So basically, your facility is not doing so well at preventing that particular HAI if the SIR is greater than 1. Conversely, a SIR less than 1 indicates that fewer HAIs were observed than predicted. If your facility SIR is less than 1, your facility is doing better than expected. In our Hospital X example, the calculated SIR would be 19 divided by 21.7, or 0.9. This SIR is below 1, so it seems like Hospital X is on the right track. However, we have one last metric to look at. Remember when I mentioned the 2020 HHS goals? Well, these are more specifically called the 2020 HHS SIR goals, and these SIR targets are included in the appendix of this report. They vary according to each HAI and are proposed targets from the National Action Plan to Prevent HAI, Roadmap to Elimination. Your facility's SIR must be below this number in order to meet the proposed targets. For example, for CDI, your facility's SIR must be below 0.7. For MRSA, it has to be below 0.5, and etc. So let's go back to our example. It seemed like Hospital X was doing well with a SIR of 0.9 because it's below 1, but now we have the 2020 HHS SIR goal, which is telling us that since the SIR is above 0.7, Hospital X is not reaching the national target. The last metric that we'll go over is the CAD, or cumulative attributable difference. This metric takes into account the 2020 HHS SIR goal and is defined as the number of infections that must be prevented within your facility to achieve the 2020 HHS SIR goal. The equation is as follows: number of observed infections minus the number of predicted infections times the national goal SIR. In our C. diff example, the CAD is equal to 3.81. In other words, Hospital X needs to prevent at least 3.81 infections to reach the 2020 HHS SIR goal. Since this calculated number is not an integer, the report will show CADs rounded up to the next integer. For example, a 4 will appear in this report as this is the number of infections that the facility needs to prevent to reach the 2020 HHS SIR goal. So to recap, on the statistics page, we'll show 4 metrics: the raw number of infections, the CAD, how your facility's SIR ranks in comparison to other facilities, and the SIR of your facility across the previous 3 quarters as well. The appendix section will show additional information such as the number of predicted infections as well as the actual rank number of your facility. In the resources page of this report, you'll find the TAP Facility Assessment Tool links as well as additional resources to prevent HAIs at your facility and resources to identify HAI hotspots in your facility. In the appendix page, there are more explanations about the different metrics and denominators used in this report. In the FAQs page, there's a list of answers to questions that have come up in various discussions with stakeholders. We also provide the facilities with contact information if there are any further questions. In summary, we're not trying to get hospitals in trouble with these reports. Our main goal is to improve HAI prevention at hospitals and track their progress. Alrighty, and thank you so much for joining us on this webinar training. And again, my name is Catherine Golenko, and if you have any other questions, please feel free to email us at hai@azdhs.gov. Thank you.